Well, I just want to say welcome. My name is Terry Hara. I am here to help. I'm a minor co-host for Mr. Charlie Froman and Scott Tips. I'm really looking forward to this brainstorm. It's Friday, March 15th, 2024. And we are having today John Droz, physicist, and Dr. Meryl Nass speaking to us. Write down your questions. Get ready. We will do questions at the end of the talk. And please keep your questions minimal or your comments so we can get everyone in. Have a good time.
Thanks, Terry, and I'll share my screen here. Make sure I get the right website to share. And let me strengthen the Zoom controls so I can see what I'm looking at. So the three phrases I'll use to describe today's show are: first phrase, early treatment; second, bioweapon; then tyranny. Mr. Droz, is it Droz or Draws, John?
It rhymes with a flower rose, so you're right.
Okay, great. Mr. Droz, a physicist, became popular in the COVID community because he did some real deep research on efficacy of the early treatments, which are more than ivermectin. There's a lot of them, and he's going to bring some clarity to that confusion. Then Dr. Nass from Maine is one of those frontline doctors. For following her Hippocratic oath, she was persecuted because you can't threaten profits of pharma or the power of government in the United States of America, as you know. She also is an expert on the bioweaponization of the countermeasures that we had to suppress the early treatments for in order to allow the bioweapons to be injected into half the world or more. And she also is an expert in the global apparatus trying to preempt our behavior to make it easier for the globalists to control us. Part of that tyranny has happened for years with suppression of accountability, namely limits on liability that we all know pharma enjoys for its vaccines. And by the way, here is the alert you received today, and I'll put that in chat so you can follow along. When you receive it in chat, please click it and scroll down, and you will see at the bottom links for our Rumble channel to watch the recording next week, our social media links, a link to all our campaigns there, and of course, the donation link. We can't do this for free. In fact, it takes quite the investment to make sure that our president and council, Scott Tips, gets to be the only natural negotiator at one of those bodies under the UN, the Codex Committee, that is in charge of making standards for food that is traded internationally. And a lot of stuff falls under food. It gets into residues allowed in the soil, the animals, the crops, of all these toxins. And he has tried to fight big pharma, big biotech, big ag, big chemical on the pesticide issue. And he actually was interviewed last night on Coast to Coast with host George Norrie, put this in chat. And he talked about his work at Codex, but also about a new threat in several states for which we have NHF campaigns, emails for you to send to your politicians in 3 states. And I'll put those in chat too: Iowa, Missouri, and Idaho. In that Coast to Coast interview, I've highlighted that last sentence. He talked about a new threat where big pesticide manufacturers are trying to quash any ability of anyone to sue for injuries from the pesticides. And with that, Scott, take it away.
Okay, thank you, Charlie, and I appreciate it. And yeah, we had a good turnout last night for the Coast to Coast interview. Had a lot of questioners call in, a lot of people with questions call in. And one guy complained I was speaking too slowly, though. But but other than that, I was trying to get the points across in a way that was intelligible. And a welcome, by the way, to everyone who is here today, who came over from the Coast to Coast. the Coast to Coast interview last night. We had a lot of signups. Anyway, the problem that, and I won't take a lot of time because really the spotlight should be shined on our two guests, that is John Droz and Meryl Ness, and they're the important ones today speaking to you. But I just thought it important enough that I wanted all of you to know that Big Ag is at it again. They want the same kind of immunity from pesticide harm that the vaccine manufacturers enjoy and have enjoyed since 1986 with the passage of the law then that immunized them against lawsuits and shifted the burden onto the taxpayers' shoulders, not theirs. So the pesticide people are at it again. They started in Idaho. They just recently lost in Idaho, but the bill basically, they were very clever about it. The bill that they introduced didn't give the manufacturers blanket immunity, but what it did do is it carved out an exception where people could not sue for the failure to warn of the dangers of using Roundup or glyphosate or chlorpyrifos or any of the other, or paraquat or any of the other dangerous pesticides. So they did this and they tried it in Idaho. They almost succeeded. The vote was 19-16 and they lost. And it doesn't look great for them in Iowa or in Missouri. And behind that is the failure in Florida to even bring it, the bill that they introduced there in Florida, to even bring it out onto the floor for a general vote. So they lost twice there, but still, we can't be sitting on our hands and non-diligent. So we have a campaign, and I would urge you all, if you haven't already done it, to go to our homepage, the NHF homepage at thenhf.com, scan down to where my article is, says they're at it again. Now they want immunity from pesticide harm. And you'll see two links in the last paragraph of the article, actually 3 links, because we want to thank the Idaho senators who voted against it, and you can do that there. And it doesn't matter if you're a resident of the state or not, just still send it in. It'll add to the general noise of people who are opposed to it. But of course, it counts for more if you're a Missourian contacting your Missouri representative, or you're an Iowan contacting your Iowa representative. But I urge everyone who's on this call to do that, and let's strangle the baby in the cradle before it gets strong enough to grow legs and take over. All right, that's really it, Charlie, that I wanted to say on the subject. So I turn it back to you.
Okay, and before you introduce Mr. Droz, in the links, I'll also put a couple of campaigns that relate to what Scott discussed. You know, whether it's over pesticide use or over vaccination of the cattle, or even the edible vaccines they want to put in the crops, or now with the agriculture Internet of Things, IoT, they're pushing with congressional bills to goad farmers into this microwave ecology. We have campaigns on all these issues for you to let your politicians know that what we want really is the opposite: organic, better than organic, regenerative agriculture. Isn't that right, Scott?
Yeah, absolutely. And I mentioned that on the Coast to Coast interview last night, but thank you for reiterating it for this program today.
And you invited Mr. Droz to come on. Why don't you tell us again who he is and the importance of what he has to say?
I will, thank you. Before I do, though, I need to correct one small thing, John, before you start going on screen too much, and that is our ever diligent Terry Hara kind of minimized her role in the scheme of things for these programs by saying she's the minor co-host, but frankly, she's the magic that makes this happen. So she's far more important than she alludes to in her very modest introduction. But be that as it may, getting back to John, I just wanted to say that I was very impressed with John after the last meeting and his comments that we had he had at the last Zoom meeting. And I got into direct contact with him. We had a wonderful conversation. But having said all of that, I have to still say that I, do not know all that much about John other than that he retired as a physicist at age 34. That's quite young. But in the last 4 decades, he actually has expanded his knowledge considerably, and he's done some rather fantastic graphics and charts showing the COVID-19 pandemic was a fiasco, and certainly the vaccinations the vaccines, I should say, that were developed were, if not fraudulent, at least certainly dangerous. And of course, we all know they were fraudulent, but dangerous and utter disaster. So he, to get this show on the road, let me turn it over to John. And a lot of what he says makes a lot of sense. That's why I wanted him on this program. John.
Okay, is the screen all right? Yes? Can you see the screen all right?
Yes, we're great.
Okay. Thank you.
Yes, it looks good, John.
Thank you. Okay. Thank you for the introduction, Scott. I appreciate the opportunity to speak to NHF people today. I appreciate Charlie's help for making this happen as well. I'm not a medical professional, but rather an independent scientist, a physicist to be exact. I've been extensively involved with the COVID matter from early on. One of the reasons is that what is good or bad COVID policy is not just a medical issue, but a science matter. In my opinion, it's unfortunate that more non-medical scientists have not been intimately involved with things like COVID policy, as science is being abused here. I purchased a website to post some select information on COVID. I tried to pick an easy to remember name, c19science.info, and that's what I'm showing you here, what it is. Okay, so let's have a 1 minute or so quickie tour. On the top part here is an introduction, but the important part maybe is 3 reports here that I wrote here on different aspects of the COVID fiasco. You can skim through those, see if any of those tickle your fancy. And this video here has become quite popular. So this is a video about masks that parallels my report about masks. And Sydney Powell, who's a friend, she was interested enough in it that she paid to have it put into a video. The next part is some commentaries relating to COVID injections. That's this part here. And then the third part is odd and end stuff. So that's what we're going to talk about today, the second item and the third item. So let's look at the third item quickly. Since I'm involved in a variety of other policy matters, energy, climate, stuff like that, I couldn't help but notice the parallels with climate change, talk about policies, there's the climate change situation and the COVID situation. So I decided to write them down here. I haven't seen anybody else that's done this. Could be wrong, but to my knowledge, not. So there's some interesting comparisons here that shows that, in my view, that what they did in COVID wasn't just a random bunch of actions here, that they have sort of an overall plan to bring about these type of things. So we're under the time frame gun here, so we're going to be short on these type of things. But after, oops, that's what I didn't want to do. After we finish up, some other time you might want to go back and look at that. So that's the second one here. I'm sorry, the third one, I might say. Okay, so we're going to finish up here on this part. This here, what I did was I put together an Excel spreadsheet because I couldn't find an overview of all early treatment COVID options, particularly in an easy to follow format. So I made this up. So it's my selections here as to which things to look at, which things to compare them to. As you can see here, there's a variety of comparisons. So the first two on the yellow are what are EUA approved items by the FDA. The white items are OTCs. The gray items are our famous HCQ and IBM. And then these are the salmon ones are monoclonal antibodies. And then just for entertainment, I guess you'd say, all those others are early treatment, but this here is a late treatment. So I put down remdesivir to just see how that compares. And doesn't take very much looking here to see that this is pretty ugly. So what I'm doing here is I'm surprised that some of this is still going on here. So for instance, let's go back to my other chart here. This is my Substack, and I put a link to my Substack in it in the chat. So what I'm surprised about is that there are people who are still talking about this as if there was nothing changed. So for instance, here I have, this is a part of a two-part commentary that I posted last week. Part one, as you see here, as I'm showing you, it's about a recent article by Johns Hopkins where they are still pushing Paxlovid, and there's zero mention of anything else. So to me, it's one thing to say, well, in 2020, they didn't know any better, but in 2024, they do know better. So the question is, why are they still doing this, even though they know scientifically they're wrong? So if you read my two-part things here, I put a link in the chat here as to how to get to that. And you can see for yourself that I think there's numerous failures that are being done here by major medical places like Johns Hopkins. So this is a long story. I'm not going to go into that, but I'm just giving you a link here. You can see that for yourself. Okay, so the last thing I'm going to do here is I'm going to take this other chart here, which is our major chart, and go to abbreviated version. Can you see that, or do I have to restart? You see the condensed version?
Yes.
You do?
Yes.
Okay, thank you. So what I took out is some of the other extraneous things out of the full version so that you can make it easier to see here. So this table is not online, that's what I'm showing you, but if you want any information on this table, just go to the full version and it'll be there. So what I did here is I extracted from the full version 3 starkly different COVID early treatments to make it clear about the unscientificness of COVID policies. The top part of the Paxlovid info is broken into 2 columns. The left side is what the FDA used to conclude that Paxlovid was worthy of giving the manufacturer here an EUA. Basically what it is, one study from the manufacturer, Pfizer. The right side is where we stand now. That's this part here. And what we have now is there are 56 additional scientific studies about the efficacy of Paxlovid, and 42 of them focused on the early treatment effectiveness, which is what I'm primarily interested in, the early treatment part here. What should stand out here is the radically different result from the independent scientists' conclusions compared to Pfizer's initial test. Pfizer, as you see, had concluded that it was 88% effective, circling that there, based on their one study. But after we now have 57 studies, including Pfizer's, still in the mix here, the actual efficacy is 21%. So this is my opinion, this is what the studies say. So that is pretty substantial difference here, and in my view, and I would think in any scientist's view. Now, if you then compare this right-hand column, this is the actual current state of affairs for Paxlovid to these other 2. So vitamin D here, again, we're looking at the early treatment part, so that's this portion here. So they've had tests that have done 43,000 plus people, which is a lot. But the efficacy of vitamin D has been worked out based on these studies to be 60%. So compare 60% to 21%. And a similar thing on ivermectin, 38 studies, 58,000 plus, 62% compared to 21%. Seems to me, as a scientist, that that's a radical difference between efficacy. 28% roughly compared to 60% roughly, 3 times the difference. And yet in that article I showed you about John Hopkins just less than a month ago, they don't mention a word about any of this. The last part here I'm going to go over is the safety aspect, because the 2 most important considerations for all drugs are efficacy or effectiveness and safety. This info is in the bottom part there as I'm circling, right? So what it says is that the safety of Paxlovid is far inferior. All the things I put in red are negatives. So every negative number here is a red number. Green is positive, as it says in the bottom here, the decoding here, coding here. So what it's showing here is that not only is the efficacy of Paxlovid far inferior to OTCs and ivermectin, but the safety profile of it is far inferior to the OTC or ivermectin. The last part is the cost, and that is obviously a big difference as well. So what can I tell you? Every single part of it looks bad for Paxlovid if you look at it from a scientific point of view. Again, none of this is opinion. This isn't just conjecture. This is what scientific studies are actually saying. So bottom line is, I'm being very super brief here. I recommend subscribing to my Substack commentaries. I put the link in the chat there, because I cover a variety of issues here, from COVID to election integrity to education, so forth, that are all related to this here. And so that's all I have to say here. Be a very brief interview. Charlie made it clear to be moving along so we'd have more time for questions. And I will answer any questions after my good friend Meryl has her say.
Thank you, John. Yeah, let me just say something real quickly, Charlie. I didn't say it in the introduction and I should have. And that is, a lot of John's material here is good, will constitute great arguments for us to use and resource materials for us to use in arguing these cases against the COVID-19 vaccines and the like. So, I mean, this is incredibly important material, partly because it's been so well organized. A lot of this data we've had at our fingertips, but it's never been so well organized and presented. So I just wanted to thank you, John, for doing all of that hard work that helps the rest of us argue this case against the COVID-19 vaccines or anything similar.
You're welcome. I'm an organized person, yes.
Yeah.
Indeed. Thanks, John and Scott. And in chat, I put another campaign related to this topic, and that's our longtime advocacy for more natural treatments, specifically the homeopathy and natural compounding world, both of which are being persecuted by the FDA as we speak. And in future monthly Zooms, we'll have some of our friends from the homeopathy world return to help tell us how we can help them against the FDA persecution. And I think Dr. Nass can comment on Mr. Droz's presentation, because among the early treatment heroes during the COVID pandemic, she, unlike others, I don't know too many others, were actually delicensed from the persecution of the licensing board. And it was such a sham operation, like a lot of them are. But not only is she a frontline hero, she also is an expert in something Mr. Tips has talked about before, the risk of viral weaponization. And with the preemption threat from the World Health Organization, one of the aspects of that threat entails the information sharing among member nations of this research. And I think we all know by now that all these labs in Ukraine and America and around the world to create, Franken viruses has the goal of creating countermeasure vaccines that also are Franken vaccines. Not that any of us in this call would even think about taking that nonsense. So from the work of James Roguski, the Sovereignty Coalition, the grassroots is building to leave the WHO. We have a campaign to leave not only the WHO, but also the UN. I think that'll be a discussion we'll have after the presentation. Is leaving the WHO enough? How do we get the grassroots really to build to insist on sovereignty around public health measures? and we'll have to accept that it goes way beyond health. They'll, as you know, Meryl has a famous tweet where she's testifying that the language is so loose that they'll use any kind of emergency in quotes to justify preemption. So with that, Meryl, take it away.
Thank you. Well, let me share my screen and get going. Hopefully that will work. Good. Okay. What's going on with the WHO? How long do we have? How bad is it? I'll try to get to all that today. And here's a summary. I'm going to summarize this a few times, but a summary of what the WHO is trying to do. Before I do that, why don't I just tell you why? And the why is basically globalists who would like to take over as much of the world's resources and authority and basically get a global government have seen, in fact, possibly created the WHO in certain ways so that it could be used as a mechanism to do this. And that's because the WHO is completely untouchable. There is no court that has jurisdiction over it. There is no way individuals can influence it in any way. Everybody there has diplomatic immunity, and there is no Security Council like at the UN where anyone has veto power. So the WHO had the ability to put forward treaties. It has a constitution. It is the only sub-agency under the UN that can make treaties with nations. And for all of that, it is being used to attempt to take over. This would be, of course, a bloodless coup. What do they want to do? They want to get rid of free speech. The WHO is asking all the nations to give it authority to give them orders that will have to be obeyed. You would think, why would any nation agree? It doesn't make sense. But apparently many or most of our nations have already been taken over by people who or forces that are in thrall to the globalists. It's a powerful statement. And so they're willing to do this, or they're blackmailed into it. We don't know. They want the right to tell us what medications we must have, such as vaccines, medications such as hydroxychloroquine and ivermectin, they will not allow us to have. They want to close borders and influence how we travel, whether there is contact tracing, quarantines, masks, all of that. Privacy, they're demanding that nations perform surveillance of the social media presence of everybody and censor it if we are saying things about public health that go against what the WHO wants us to say. And they're requiring nations to do this. The WHO wants to have the biggest library of potential pandemic pathogens, which are biological warfare agents. It's another word for it. And they will share them globally with universities, nations, pharmaceutical companies, and research centers. And they're demanding that nations give them specimens and that every nation have its own sequencing laboratories, which is very peculiar, and then put the sequences of all the potential pathogens they find online, where of course they can be hacked, and anybody who's good at hacking can download them and create these potential biological warfare agents. They're not telling you what it's going to cost. They don't know what it's going to cost, but the WHO budget now is about $4 billion a year, and it could be 30 or 40 billion to manage all of this. And they've got a foolish concept called One Health that doesn't mean very much, except that it wraps everything in the world into the basket of health, and then the WHO Director General can declare pandemic emergency or public health emergencies for things that are not directly related to human health, but may be related to plant or animal health or ecosystem health. There are two documents doing this. One is amendments to an existing international health regulations. The other is a treaty don't bother reading this. They created these documents to be as complicated and confusing as possible, so nobody understands what's going on. You just need to know there's two documents, and the WHO and the globalists will be happy if either one of them passes. They have a lot of overlapping provisions. I'm going to go through just a few of the things that I've already told you, but I'm showing you the documents. There it is. This is what they will require. On the right, that's in Article 18 of the regulations, the health regulations. This is how they want to expand their authority from, I've got to move this away, from only responding and being commensurate with public health risks. Now it's all risks with a potential to impact public health, which could be gun violence, climate change, etc. This is the article where they can restrict your use of medications during a public health emergency. This is how censorship is to be imposed by calling what we say disinformation or misinformation and requiring it be stopped. They talk a lot about health coverage. They don't mean healthcare, they mean health insurance. They want everybody in the world, if possible, to buy health insurance. What is this concept of One Health? There's a word salad that has been created and is used everywhere to try and explain it. It's an integrated unifying approach that aims to sustainably balance and optimize the health of people, animals, and ecosystems. It recognizes the health of humans, domestic and wild animals, plants, and the wider environment are closely linked and interdependent. It mobilizes multiple sectors, disciplines, and communities to work together to foster well-being and tackle threats to health and ecosystems while addressing the collective need for clean water, energy, and air, safe and nutritious food, taking action on climate changes, and contributing to sustainable development. So that's the word salad. Everything in the world now is part of One Health. And here in the Lancet, January, a year ago, an editorial, one-page editorial was published. And they say that the reality is that One Health is taking a fundamentally different approach to the natural world, one in which we are as concerned about the welfare of non-human animals and the environment as we are about humans. And this is ecological equity. So this is a way to downgrade the value of humans in our brave new world that is coming. So tell us more about this WHO that wants to be the governor of health and information for the world. Well, we have Tedros, who has been accused of covering up epidemics. His ruling party are considered to be terrorists, and he has no medical degree. He calls us liars. He claims that by challenging the pandemic accord, we are endangering future generations. He tells lies, saying the WHO is not a party to these documents, but in fact it is if you read them, etc. Now, is the WHO a trustworthy organization, apart from Tedros himself? No, it isn't. In the last 12 months, and this was published in October, over the last 12 months, the WHO Office of Internal Oversight Services investigated 287 allegations of sexual misconduct by WHO staff in its regions. Most of that was in the Congo. And then the WHO put the managers of those people, they gave them, I guess, a paid leave, and then they put them back to work with no punishment afterwards, which was a scandal. These are two AP articles on the left. Why does the WHO act the way it does? And that is because 85% of its budget is met by donors, not by dues. So nations pay 15%, donors pay 85%. This light green is all earmarked by donors. And so the WHO is forced to dance to the tune of its donors, not the nation states that allegedly run the place. Unfortunately, the WHO is not the only international organization that has been co-opted to help gain supremacy over the world. We also have the European Union. All of them are using health and pandemics as the excuse to centralize control. So this was the EU's global health strategy, and you can see it's about global governance. They want the World Health Organization at the core, etc. And they want to bring in, of course, the private sector, the Bill and Melinda Gates Foundation, Wellcome Trust, etc., who are really driving this train wreck. The G20 and the G7 are also part of this group doing the same thing. They're after global governance. They're using the 2030 agenda, and they're doing it through the WHO. Here you have a World Bank. So there are several different financial entities that have been created to collect money for the biosecurity agenda that the WHO is to manage. And this is the first one that it has a new name. There are other ones forming. The World Bank doesn't want any others. They want to be the only one. They think there's going to be a lot of money involved. As I said, tens of billions of dollars a year. And that will, enable them to suck off a considerable percentage, several percent for themselves. So yes, they're looking for more money, domestic investments, and they want the same international health regulations of the WHO to manage it. The UN, just in case the WHO plan does not succeed, the UN has its own similar plan. They want to do the same thing. The Secretary General of the UN has already asked the General Assembly to give it the power, and they will probably vote in September, such that it can have a standing authority to convene and operationalize automatically, in other words, without the consent of the nations, an emergency platform. So in the first case, the Director General of the WHO can declare a public health emergency of international concern and then gain a lot of powers to manage it. In this case, the Secretary General of the UN would be able to do the same thing, declare a global shock and then manage it. And finally, the United States government, of course, is a main driver of this, and they were looking for $20 billion a year in this year's budget for pandemic preparedness and biothreats. All right, let me sum up. This is what they want. They definitely want sovereignty. The documents say that the nations will be required to pass laws and create the administrative structures in order to carry out what the WHO tells them. They've called regulatory strengthening an effort to push forward vaccines and drugs without licenses, under EUAs. So they're trying to globalize the emergency use authorization, because the plan is really to have vaccines developed in 100 days, pushed out to the populations with no liability. So they have said they want to manage liability, but they specify removing liability for these vaccines. You can't push out a vaccine in 100 days because it's impossible to know whether it works or it's safe in that time period. So you have to have a liability shield if you do that. They're going to censor us. They want to share potential pandemic pathogens, which means they want to actually create a situation where there are going to be leaks from biolabs all the time, and nobody's going to know where it came from because they're sharing all of these organisms. And this is a means of controlling us. We will need them to give us the drugs and vaccines for the pandemics that they will presumably create or allow to happen. One Health is a Trojan horse that simply expands the jurisdiction of the WHO. Human rights, dignity, and freedom of persons is language in the current health regulations that were struck out in the proposal. People complained. They were then put into the treaty proposal. They were then taken out of the treaty proposal. And in the very most recent 7th version of the treaty, those words were put back in. All right. And finally, what else do they want to do? Why is this happening? Well, they get to borrow a lot of money, and I think that putting nations into more and more debt gives those who are lending the money more control. It's a justification to conduct biosurveillance, and I personally suspect that the demand that every nation have a sequencing, genetic sequencing lab is probably so they can sequence, they'll have enough personnel to sequence everybody's genome. This will enable digital vaccine passports and then digital IDs, digital money. It will also give the WHO the authority to move people around by saying, oh, we have a bat cave here, and there's bats that are harboring a virus that could mutate into something deadly. So you all have to leave. You can't fish, hunt, whatever in this area. And I told you about the digital surveillance. So that's my very quick summary of what's going on. What can we do about it? I guess I'll get to that in the questions, and I thank you very much.
Fantastic. Terry, do you want to take it from
No.
here?
Thank you so much, Dr. Nass. Yes, so if you had questions pop up, I see Charles Ford with his hand up and Charles Froman. Charles Ford, you want to ask first?
Yes, thank you. I'm just, frankly, I'm sitting here and I'm just totally overwhelmed by what I've heard today. I mean, it's going to take me a month to recover. I'm interested in what we can as individuals do to combat this growing monstrosity. And I would like to just make the brief assertion that perhaps WHO is nothing more than the Federal Reserve tied to health instead of the currency. And it seems to have many of the same characteristics. And ultimately, the source of funding is going to be from the same central banks that own and operate the Federal Reserve. I just wanted to throw that out for discussion purposes. And please do give us a checklist of some things we can start to do down here at the bottom of the food chain to mitigate and prevent this horrific stuff that's going on.
Thank you, Charles. Did Dr. Nass want to comment?
Well, yes. So I agree with you. I think all of these central organizations that have private ownership or private means of control are working in sync to centralize power and control of the world. So I just basically agree with you. Now, what can we do? The WHO, as I said, because of its structure, I think it was created for this purpose in 1948 or 46, went into force in 1948. It's a 77-year-old organization. I think there's a bunch of different ways of looking at it. I think the first thing is there's 8 billion people on the planet. We've already been completely lied to and damaged by our leaders. And at some point, we're going to have to say that we're not going to go along with the leaders and the legal structures that they have put in place. I mean, this is legalisms, you know, this is lawfare against the people. And they have, the globalists have control of the diplomats, have control of the Biden administration, have control of many things in this world, most of Western Europe, Australia, New Zealand, maybe, you know, there's different parties. In Europe, there are different parties, but the populist parties are all minority parties at the moment. So it's going to take the people. Okay. At the same time, there are things you can try to get done with your governments. And in the US, we have probably a better chance than almost anywhere else. And that is because in our Constitution, the 10th Amendment says that authorities not given to the federal government are reserved for the states and the people. And healthcare is not in the Constitution. It is a state or personal authority. And so I've created an organization, founded at Door to Freedom, doortofreedom.org. I also work with the Sovereignty Coalition, sovereigntycoalition.org. I work with Children's Health Defense. And we all are working towards encouraging at the state level states to say no. And that can be in Florida, there are counties that have said no. We would like the attorney generals. We are trying to help encourage Republican, in particular, attorney generals to sign on and say, no, we are not going to turn over authority to the WHO. We don't want we're not going to let the federal government do it because they don't have it. We do. And we are encouraging, we've had some problems finding the right people, but we would like at the state level, simple resolutions to be introduced. A resolution's not a bill. It can be introduced later. It doesn't require any expenditures or any enforcement by the state. It doesn't last that long. It doesn't need to be read over and over by the legislature. It just simply says, we're not going to go along with the WHO's orders. And so we have a model resolution on the Door to Freedom website. I'm not sure I can put it in the chat. It's a PDF, but we would like members of the legislatures in the states to put these resolutions out there and start a conversation in the state legislatures about what is going on, because virtually nobody understands this. I've briefed about 16 members of Congress and they did not know what was going on. So what's critical is to get this information out to the public.
Thank you so much. Charles, did you want to go ahead and ask your question as well?
Sure, and let me share my screen real quick. So one of the campaigns I put in chat from NHF would have us leave the WHO, but also the UN. And I thought it might be good for you to comment on the solution to our problems from leaving the WHO, whether that's enough, or whether given Agenda 2030 and the very public and nefarious schemes to buy up our farms and attack our food supply, whether we need to, separate entirely from the global bureaucracy.
So it's such a big lift explaining to people that the WHO, this organization that they thought was helping the third world, and that's why we've given it all our so much money over time. It's such a lift to get them to realize this is actually a scheme to take over. We don't have time in the 10 weeks before the WHO votes on these documents to educate enough about the UN. So I and my colleagues at Sovereignty Coalition and Door to Freedom think that at this point in time, we should forget about the UN. We should not include it on a resolution or anything else. But the UN is Plan B. The WHO is Plan A. We all have to realize that. And the end result is a global government, one world government. And so as we educate, we will educate in the future about the UN too.
Great, thank you so much. Dr. Silverman, I have unmuted you.
Meryl, I'm curious, do we know specifically who are the American representatives who are doing the negotiating with the WHO? If we wanted to
do.
Letters specifically, do we have names and email addresses?
Yeah, but the two people that have been put before Congress to discuss this lied about what was going on, misrepresented, denied, lied. And so Lois Pace is nominally the chief negotiator. John Nkongasong, who is a Cameroonian, who was head of the African CDC and is a joint Cameroon-American citizen, is also a top negotiator. They are completely bought. A third person is, I forget his name, he's an Indian American who has written a lot of books and was really considered to be a great guy. And now he's gone to work for USAID, which, as everyone knows, is like a spinoff of the CIA. So when we had a delegation to the WHO 2 years ago to work on other amendments, the United States tried to push this sort of thing forward 2 years ago. They had 65 names on the delegation list. So it was starting with the head of HHS. So it's the State Department and HHS that are managing this.
That is deeply troubling. Okay, Linda Varsu.
Yes, thank you, Mary. I follow you daily. Regarding the vaccines, more people died from the vaccines than from COVID. As an expert immunologist, I say again, no to all vaccines, from the newborns up to adults. No vaccine can benefit our health. I would like to bring another issue, like in Baltimore. We have so many chemtrails every day, many times per day in our sky, that we pollute the air, the environment, the food, the soil, everything. And finally, a question. We are 27 participants. So with this fantastic organization that we have, I will expect 3,000 participants. There are some webinars where they assume that they have over 2,000 participants, and they are not so important, I tell you. You are the most important. So try to find a way to make 3,000 participants if it's possible. Okay, Charles? Try to find a way. Thank you. Thank you.
No problem.
Charles, I'll help.
You always say that, Jeff. Your help is welcome. Appreciate it, buddy. Comment on your geoengineering threat. Later, I'll preview next month's show when we'll have a legislator from New Hampshire and a returning expert on that very important issue about the cloudiness that's artificial. So come back next month.
I did have a quick question, and then it's Sharon and Aaron and then Jeff. Well, actually, I guess it's more of a statement, because I think Charles touched it a little bit, is that when I discovered that there is something called Agenda 21, and then they made it Agenda 2030, anyone can buy their agenda on Amazon. I mean, the great irony of all. And you could read it, and you find, like, at chapter 7 or 17 or something is their medical agenda. And it's not just that they want to own us medically. They would just want to own everything. And they do it by harnessing your goodwill. And it's very disturbing. And I don't know how to get into educating just friends and family on how manipulated they've been. Maybe you can touch on the psychological component if you have any feedback about that. How do you reach I mean, I know legislation is really important and you have to do it locally, and I'm doing whatever I can to help with that, but how do you talk to people that you care about that don't understand what's happening?
I don't think I mean, everybody knows there's no easy answer to that. We know that the brainwashing is very sophisticated. We know that you know, if you watch television, if you get your information from NPR or whatever, your New York Times, Washington Post, you will not be able to see through. I mean, it's as if there's a wall. There's half of us that get our information from alternative media, and we have one view of the world, and the other side has another view. And it's actually impossible because the facts are different in the two worlds. Now, I believe that the other side is actually in the minority and we're in the majority. It's just that the sort of intellectual type people who read the New York Times, you know, are there. But all the people that don't read the newspapers pretty much are with us. I mean, all the tradesmen who come to my house, you know something like this is going on. They don't know the details, but they see it and they feel it. So I think that look, I have a son who's a doctor, his wife's a nurse practitioner. They all are vaccinated. The kids are vaccinated. The father-in-law just died from a turbo cancer. They must be subconsciously thinking that it was due to a vaccine, but how can they bring that to consciousness when it means they've poisoned their own children, the most important thing in their world? So I think that the clever, evil people who created this mess we're in knew all that when they started and created these basically double-blind problems where people like my son cannot get out of it, because to acknowledge what's happening in the world means to acknowledge you poisoned your children. So I think, you know, some people we have to let go.
Thank
Yep.
you.
I have 2 cents there.
Yeah, of course.
Okay, I think one of the problems we have here is that our opponents, I'm talking about left people, in my view, are playing a long game where most everyone that you deal with in America is playing a short game. And because we're continually bombarded with advertisements, media, and so forth, to have immediate gratification, things of that nature. So an example of this is that about 12 years ago, a group of progressives decided to infiltrate and change the science education of K through 12 schools in the United States. This is something I happen to be an expert on. And so they instilled a whole variety of things in a package called NGSS, Next Generation Science Standards. Without going into the details of it, the most problematic part, in my view, is that I personally think that the #1 objective of our K through 12 education should be to produce critical thinking graduates. However, the NGSS specifically is designed to produce non-critical thinking graduates. So they know very well that the biggest threat they have is critical thinking citizens. So they are starting here and have been doing this for the last 10 plus years. No one is saying a word about it. I mean, essentially no one. But that is something we have to fix. I'm working out in North Carolina. Some things have gone very positively, but I don't want to get into it unless you really want to talk about it more. But I'm giving you a long range solution, and that is we need to teach our children to be critical thinking graduates, because that means they will then become citizens who are critical thinking graduates. And that will be one of the more powerful responses we can ultimately have.
Thank you so much, John. Sharon Ward is next.
Hi, thank you, Dr. Nass. You're my hero. I read your Substack, and I just signed up for Mr. Droz as well. But I am a traditional naturopath, and I've been treating people with COVID, and myself and friends and family completely naturally with no pharmaceuticals at all. Maybe one Advil here or there. But I'm wondering if there are any studies about using I also include synthetic vitamin D as a non-natural supplement, and even too much zinc and that sort of thing. It's mainly herbs, homeopathics. Are there any studies using just
So if you go to the C19 website, c19study.org, they list about 30 or 40, I think about 40 different substances that have been used, and they list all the studies for each one. So you can look each one up, like Nigella will be on there, and other herbs. I don't think they have homeopathics, but it's a very good website.
Yeah, and it's interesting. One of the biggest things right now for people with the glyphosate and the polluted wheat that we have, a lot of the coughing, I tell all my clients, get completely off of wheat, because when your gut is irritated, your lungs are also irritated. So that was one big key for healing for a lot of people. But thank you so much for what you're doing. You really are my hero. Thanks.
John, did you want to respond?
No, other than the fact that that's why I included the OTC vitamin D as a quasi-natural thing here that is proven to be valuable. But a lot of my stuff did come from the site that Meryl's referenced her to, because it's a very credible site.
Yeah, that has been helpful for people, because it's like a natural steroid, and it does help people a lot. But I've been able to treat folks without that at all. But anyway, thank you all so much.
Erin McDowell is up next, and then Jeff.
Hi, everyone. Okay, my head's reeling here a little bit, but I have two questions. And Dr. Nass, it's a pleasure to have you share all of this information. So thank you. My first question ties in with the major hospital networks and what their role might be with advancing this agenda. And in particular, I'm talking the Cleveland Clinic. And the reason that I bring that up, because I didn't realize what you're talking about, how much happens at the state level. And at one point during COVID, our governor was doing these briefings on TV and said that he would be taking, his advice from the Cleveland Clinic, which is smart. Let's do that. Let's get some good information, especially for elected officials, et cetera. But for guidelines. But at the same time, nothing was really mandated the way that I saw in other states, but it's also, I did not elect the Cleveland Clinic. And so, like I said, we didn't have the kinds of mandates that some states did, thankfully. So I'm unsure, but I was noticing this early on. My background, I'm a registered nurse, I'm traditionally trained. And so there were just some things, though, a lot of red flags in the beginning, like I'm sure with a lot of people. So that's my question to you about what major hospital networks might be involved, or are they involved? Or what is your feeling on what their stance might be on this? I'm very interested in hearing what you have to say on that. And my second question then is comments from you, from people in the group about the wireless mesh network. How is this playing into this? As a person who has been injured from this, and it happened to me in the middle of the night while I was sleeping. So, I really, truly, whatever happened, well, there were 2 small cells that were activated. But nonetheless, it happened in my own home while I was sleeping, and that's how I came into this group. If you would comment or could give some insight into that as well, thank you very much.
Yeah, you're welcome. So the Cleveland Clinic, has subsidiary hospitals in other countries. It is a, multi-billion-dollar enterprise per year, and therefore its bottom line is, a big issue. And because hospitals were bribed basically to go along with the program and label patients as COVID cases, et cetera, they did it. So they're all now complicit. All the hospitals know that they killed people by following these protocols, and they followed the protocols because they were given higher reimbursements to do so. They're not going to be able to admit that. Where they go in the future with it probably depends on their CEOs. Cleveland Clinic is known for good medical care. My son worked at the Cleveland Clinic for a while. He was very impressed with it. We'll see, but you have to realize it's a multi-billion-dollar industry, and that's that. Now, as far as the EMFs, some people are more sensitive than others. So some people are definitely going to get sick when you turn on an EMF system, like a 5G system, near them, and others will not. Yet it's part of the toxic load that we're all exposed to. We're all living in a toxic soup of EMFs. Whether that can be identified, I don't know. From what I've been able to ascertain, we don't have the evidence yet that the what was injected into you is turned on by electromagnetic fields. I don't think, but I'm not going to say it isn't, because I don't think we know.
All right, thank you, Dr. Nass.
Can I just add really quickly? I did not take the vaccine or shot, whatever you want to call it. So I specifically did not take that, and I was healthy. I was a healthy individual prior to when these towers were activated. So my concern is more for people who, like my husband,
there's no question that people have electromagnetic sensitivities of different kinds. I've treated people with that problem for, more than 20 years. You get somebody near a cell tower who has this sensitivity, and they will immediately get a headache. I had patients in my office, if I had a fluorescent light on, they'd have a headache. If I turned it off and used an incandescent, the headache would go away in a couple of minutes. So there's no question that that sensitivity exists. And you may feel better, for instance, if you turn off the router in your home and use an Ethernet cord on your computer. but you need to look that up, but it's a real thing and you can do things about it.
I just did that. Okay, so now we have Jeff Ellington with his hands up. Sorry, I'm just trying to, there's 4 hands up and I want to make sure we have like 15 minutes left, you guys. So if you could just get your question in, and you are unmuted, Mr. Ellington.
Thank you. It's good to see everybody here today. So, where are you in North Carolina?
You were
John
asking,
Draws?
I didn't hear. I'm on the coast, Morehead City.
Where are you in North Carolina? I'm in North Carolina, right near the Research Triangle Park.
I'm on the coast, Morehead City.
Whereabouts?
I'm on the coast.
I got you. I have a daughter, Ocean Isle, and I'm just wondering how close you are to people that I visit all the.
Morehead City, middle of the
Okay.
coast.
Okay, so I have. Do you know Dr. Randall Williams? He's a close personal friend and physician. He also happens to be the head of HHS, and he was the first doctor that I called when my wife died within 48 hours after taking the J&J vaccine. And so I think I'm planning to get him in touch with other physicians that I work with locally who were essentially tossed out of the health systems because they're with us and could not go along with the narrative that's out there. But my question would be sort of to you with respect to these attorney generals that, as I understand it, are increasingly important in trying to ensure that we get leverage at the state level, since that's probably going to be our best pathway. And I do have close friends that are getting me tied to the guy that's getting ready to run for attorney general, or who is running unopposed on the Republican ticket for attorney general in North Carolina, a guy named Dan Bishop. And I'd like to be able to leverage whatever relationships can emerge from that, so that we can try to get as many of these AGs throughout the country, on side with what they need to understand and know. Now, part of what we need to do is simplify all the great content that you and John have provided here, so that we can create platforms for anyone who is running for office to embrace as a platform. I don't care what they're running for. They need to have a consistent platform that moves people in this direction. And so I'd be very interested in trying to help, develop that, or if it already exists, I'd like to see it.
Okay, Jeff, you broke up a bit there, but I do know Dr. Williams. I've communicated with him. I'm working with the person who is the Republican nominee for the state superintendent of education, which is
Who's that?
Michelle Morrow.
Well, we should let's plan to talk offline, John.
Okay, fine.
I'd love to do that.
Mr. Ellington, his email is in the chat.
I think I got it. Thank you.
Thank you for coming. Odette.
Hi. I'm Odette Wilkins, and I'm chair of the National Call for Safe Technology, and that deals with the 5G rollout, the 4G rollout throughout the United States. And there are a lot of people who are opposed to this, and some communities have been very successful in stopping these towers. However, there is a slate, and actually an avalanche of federal bills, over 60 bills now in Congress, which are designed to take away local control. So whatever successes people have had around the country will be taken away by these bills if these bills pass. My question is, with respect to the WHO and the UN, and because the 5G rollout is becoming ubiquitous. It's not just in the United States, but in the world. And that not only will it exacerbate people's health conditions, but it will also increase surveillance. It will also increase the ability for the government to be able to control people. Particularly, they're saying that 5G has to be very close together because the frequencies are so short, the wavelengths are so short. But the advantage to the government is that because they're so close together, they can then conduct more surveillance, and there can be a greater invasion of privacy, not just in the United States, but in the world. So I'd like to pose this question to both of the guest speakers about how this might, enhance the kind of preemption that the WHO and the UN are trying to implement.
Well, I'm not sure what you mean by preemption. I will say that Children's Health Defense was involved with, I forget the name of the other organization, in a lawsuit because, what?
Environmental Health Trust.
Thank you, exactly. Lawsuit because the 5G towers were only allowed by the FCC to be regulated on the basis of their thermal effect and not any other electromagnetic effect they might be creating. And that was a very interesting rule, and it was 25 or 30 years old. And so we went on the first level, and the FCC was directed to go redo the rule. And I'm not sure where it stands right now. We may still be in the middle of it, but you're absolutely right. There's a big problem. And the other side wants this very, very much, and they will fight very hard. And we need to fight very hard also and see if we can use the courts. I mean, much of the courts seems to be in tatters, but occasionally we'll get a good ruling, a fair ruling.
Well, we've been having a lot of success on the grassroots level. We've been talking to a lot of legislators on the federal level to stop this local preemption, but there's been a lot of success on the local level, which is what these federal bills are trying to undo.
Well, this rule, which was federal, didn't allow local communities to regulate these installations. That was the problem. If it didn't hurt you by heating you up, then it was, defined as not able to cause you any harm. And so, yeah, there have been some local cases, but it has to be one on the federal level. Otherwise, all the local things will just be destroyed.
Right. Well, it's been remanded to the FCC for reconsideration based on the 11,000 pages of scientific studies showing harm at their levels. However, the FCC has not done anything. I believe the courts have given them an additional 2 years to come up with it, but by that time, we're going to be blanketed with the 5G towers. And so by preemption, I mean that the WHO and the UN can override local any kind of local protections. And
so that is not in these documents at this time for the WHO.
Okay. Thank you.
You're welcome.
Thank you both. Charles Froman has his hand up, and then Mark Krebs.
So let me share one of our campaigns. This would, let's see here, which one is it? The Zoom controls hide my tabs, so it's hard to see. It is this one. We have a campaign to support conservatives in the House appropriations spending process because they have added several amendments, which will be defeated because the Democrats control the Senate. But I think people should send our email on these amendments because it's good to support those conservatives who stick their neck out for health freedom. And I wondered, Dr. Nass, if you had any comment on some of these. The big one, of course, would be defunding the WHO. Number two, ending research into edible vaccines. Number 3, protecting homeopathy. Number 4, this relates to your presentation. There's one amendment to defund at least a quarter of the Homeland Security bureaucracy in charge of the cognitive censorship. And number 5, which also gets to your presentation, defunding research into viral weaponization. And number 6, the TSC vaccine mandate for travel. A lot of good efforts that are all going to lose, but the point is, get the emails to start the pressure to grow the grassroots. We have a long way to go to win on these things, but we do have some friends in Congress like Tom Massey and Chip Roy and others. What do you think about these amendments, Dr. Nass and Mr. Droz?
I think it's really important to chip away at every lever we have, and this is an important one. In fact, the State Department and Foreign Operations bill is coming up for a vote next Friday. We believe the leadership of the two parties is working on making the sausage right now. They may come to a final decision today or tomorrow. And in that bill, that is the one that defunded the WHO in the House and also required the Senate to actually perform a ratification of the pandemic treaty. So that's a very important bill. There was a lot more in it. Probably most of the people who voted in the House didn't even know what they were voting on. But it's coming up for a vote of everybody on March 22nd, a week from today. But right now, the leadership on that bill, which is Kay Granger, Susan Collins, Mike Johnson, and Mitch McConnell, if you are in their districts or if you care to write to them, on the Sovereignty Coalition website, there's an Align Act. You can go there and click and send messages to everybody. That would be great. And follow these other bills that Charles has just told you about, because even if we don't win, if the other side thinks we're weaker, that they're going to just do more to us. And there's possibilities we can win. I mean, if the Republican leadership holds firm on these issues and gives way on other issues, we might be able to get these things through, because they have to fund the government. So the funding bill will get through. There's just a question of what's going to be included in it and what's going to be cut out. So this is the issue of making the sausage. I would definitely please go to the sovereigntycoalition.org website and at least send messages right now, today, to these lawmakers.
Indeed, and I'll just add that in chat is NHF's campaign that takes just a minute to scroll to the bottom to input your zip code to send our sample email to all the politicians, because they all need to hear about these amendments that would defund the worst aspects of the bureaucracies. Terry?
Okay, thank you both. Mark Krebs, you are our last question.
Hi, thanks. I'm keeping my background blanked out to not disclose some of my activities. But my question is to Dr. Nass. I appreciate what you've been through. I've Googled your name and I've seen all these attempts to remove your medical license. Yet in your talk, you talk about seeing patients. So just what's status of all that? Are you persevering?
Yeah, my license has been suspended for 2 years and 2 months. I don't think they'll ever give it back to me. I don't intend on following the board's recommendations, because they would like to have their thumb on my neck for the rest of my life. If I do practice medicine, they want to be managing it. So I don't think that's going to happen unless there's a big change in governance in my state. But I have found, a new career, which is making what's going on in the world known. I mean, what happened to me was simply part of this international thing. Turns out that there's a U.S. organization that educates, trains all the members of medical boards, and they've been taken over. There's an international organization of medical boards that sits in the Texas office of the U.S. organization. And the WHO just signed a memorandum of understanding with that international organization last month. probably to do the same to doctors around the world of what was done to me. So because they can't, if they're going to use pandemics and public health as the hook by which they take over centralized control of the whole world, they cannot allow doctors who have a credible voice to be challenging them. So they need to try to defang all of us. And so that's what's going on. But, you know, there it is. I'm okay. I'm old. I saved enough money during my career. I can get through this. And we're going to fight them. You know, this is basically, this is the electronic Nazi concentration camp that they're trying to bring forward. And we're not going to go along with it.
I've been canceled too. I know where you're coming from. Thanks. And the more links you can put out, and Charles in your Rumble or wherever that I can refer to, I can't follow the meeting chat links as quickly as it's being generated, and I'm kind of seriously here sight impaired anyway. So if you could get that out somewhere in a summary
Mark, that'll be in our
meeting.
Rumble. When we release the video, that will all be in there.
Okay.
So you can be able to click all those links and do all those things. Thank you so much, Dr. Nass. Charles has one more question.
Yeah, also in chat, I put again the alert, and if you scroll down, you'll see our Rumble link. So click that, and by next week, we'll have today's show loaded. I'd like to show a quick preview of next month's event on geoengineering, and it comes from Del Bigtree's show yesterday with a good friend, Jim Lee, and this is pretty impressive stuff. I'm sorry, I didn't push volume, did I?
No,
Let me reshare with sound this time.
I missed it. So this is good. I couldn't watch the show yesterday.
Why can't the average public understand that
You hear it?
semantics is what's destroying the ability to have an honest conversation about what's going on or do anything about it? And we saw this at the New Hampshire geoengineering ban attempt this month. And when they went back for round 2 with armed with different terminology, it seems like they're getting a good outcome, and they're maybe actually going to pass a geoengineering ban in New Hampshire. But
okay, so that is so let's see here. I'm having trouble stopping this.
What we're going to hear next month.
Yes, so do you still hear it, or is my sound off?
No, your sound is off. It's fine.
Good. I'm hearing it. So Meryl and John, why don't you say goodbye, tell folks how to reach you, and folks, mark a calendar for April 19th for our geoengineering show next month.
And please follow each other, find each other, email each other. We need to unify so much.
And Meryl and John want to say goodbye, and how do folks can reach you?
This is John. I put my email in the chat and also my Substack link in the chat. I also have a newsletter that comes out twice a month, 10,000 plus subscribers currently. It's free. So you just send me an email for that. It covers a lot of stuff on COVID, plus other worthwhile national things that you're not going to find on mainstream media. Thank you for the opportunity.
Thank you so much, John. And I believe Meryl. She's gone.
Well, she put her link in chat, doortofreedom.org, and she referenced the Sovereignty Coalition, whose event I attended, and I substacked about it because while they're learning about the threat from WHO preemption, they don't know about the wireless mesh that's going to enable the preemption, the control. And Odette and I presented on that last month, so be sure to go to Rumble to watch that presentation. Hey, Scott, any last words?
Only that some people who contacted me by email during this program said that they had trouble getting on, and offer their apologies to Dr. Nass and to John Droz for not having been present. I think we would have had a lot more people had it not been a problem for them. But otherwise, thanks to everyone for being on this program. Odette, always a pleasure to have you on and ask your intelligent questions or offer your own presentations. So, and everyone else as well, Linda and Aaron and the others who have asked questions. Thank you, John, for your great presentation as well. It looks like Dr. Nass has already left. So anyway, we'll see you all next time.
Thank you, everyone.